In a move that has caused shock and worry among immigrant communities, the Trump administration has shared private information of people enrolled in Medicaid, specifically immigrants, with the Department of Homeland Security. This includes personal details like names, immigration status, social security number, addresses, and even medical claims. The information was taken from people living in the states like California, Illinois, Washington, and Washington, D.C., where non-citizens are allowed to use state-funded Medicaid programs. The Medicaid programs help low-income people, including some immigrants, get access to health care. In these states, immigrants can actually qualify for Medicaid even if they are not US citizens, as long as the program is funded only by state money, not federal funds. However, many fear that the federal government could use this data to find people without legal status and deport them, or use it to deny future green cards or citizenship application. Well, the order to share the data came very quickly. Emails revealed that Medicaid officials had only 54 minutes to handle it over once the order came from the top advisor at the Health and Human Services Department. Officials inside the Centers for Medicare and Medicaid Services strongly disagreed with the move, and they argued that it could be illegal under federal law like the Social Security Act and the Privacy Act of 1974. They said that CMS is only allowed to use this information for running the Medicaid program, not for immigration and enforcement. But despite their protest, top political appointees in Trump's administration overruled the concern and forced the agency to give the data to DHS. Many experts and lawmakers have now raised serious concern. For example, California Governor Gavin Newsom's office called this data sharing deeply concerning and possibly illegal. A US Congresswoman said that using someone's healthcare needs against them is cruel and will only bring fear and pain to immigrant communities. But you know why this is happening? Well, it's part of a bigger effort by the Trump administration to find and deport people living in the US without any legal status. In February, Trump signed an executive order called Ending Taxpayer Subsidization of Open Borders, which aims, by the way, to prevent undocumented immigrants from receiving benefits paid by taxpayers. Following that particular order, CMS began reviewing whether some states were wrongly using federal money to help cover the immigrant with unsatisfactory or unclear immigration status. In June, states like California, Washington, and Illinois handed over the data of non-citizens in their Medicaid system, believing that it was part of a routine review. But later on, they discovered that this particular information was shared with deportation officers. Many are angry and they are feeling betrayed. An internal memo written by a career official, Sarah, explained that in details why sharing this particular information was not just risky but possibly illegal. She also warned that this would damage trust between states and federal government and might make some states hesitate to cooperate in near future. CMS, she said, has never shared personal health data with immigration agencies before, and DHS has no role in running Medicaid. Still, within just a few days, Trump officials ignored these warnings and forced the data transfer. Well, some officials fear that this is just the beginning. In another case earlier this year, a federal judge allowed the IRS, that is the tax department, to give immigrant data tax sharing to ICE. And that was just to help track people down for deportation. Well, this pattern shows that the Trump administration is trying really hard to connect different government departments to help immigration enforcement, even when those departments were never meant to be involved in deportation work. People are now asking, will immigrants avoid going to the doctor out of fear? Will they stop applying for help that they legally qualify for? Many experts believe that this could create a chilling effect, meaning that migrants, even those with legal status, might avoid Medicare, public benefits, or even applying for citizenship simply because they are scared that their information will be used against them.